what we have here is a hog spinal cord, two different spinal cords, and we're going to go over just a few things that you're going to see in lab. This is a cross section of it, and you're going to look at this under the scope. You'll be using your dissecting scopes for this because they're a large piece of tissue that you're looking at. But with this butterfly, we call this butterfly, and that is your gray matter. You can see the dorsal horns up here at top, ventral down here. Now, of course, this is going to look a little bit better underneath the dissecting scope, but this was just a cross section to show you this. Your ventral fissure is very deep compared to the dorsal sulcus. All right, white matter all around the butterfly or the gray matter there, and we're going to learn more about that when you do the scope, but I want to show you that cross section. So what we have here, this is the superior end that was up towards the skull, and then it goes all the way down to this little area here. Now, what's been taken off of most of it, this is your outer meninges, the dura mater, the very thick, and you'll see that. That'll be easy for you to identify. Next, you see your arachnoid, this meninge, and you can pick this up. I'm picking it up with this probe. Very thin, but you can pick that one up. The pia meninge, pia mater, does adhere, and you'll see it on the scope, but it's hard for you to see it on the macroscopically. So you'll be able to see the pia on the scope. So with this, you see dura and your arachnoid. Also, all along the spinal cord, you're seeing your vessels. Okay, sometimes you'll see some hemorrhaging with those vessels. With this, when the dura mater has to be adhering to the cord somehow, and with this is called denticulate ligaments. Here is a real nice one here. Every once in a while you'll see this little, it's like a little tag that holds this on. Okay, now what you're going to see also is this big fan-like structure. How's that coming out, Doctor? Okay. Okay. This big fan-like structure, these are actually the rootlets. Okay, now to figure out if they're dorsal or ventral, this is the ventral side with this vessel. Okay, you're not seeing that large vessel here, so those are most likely dorsal. We will not test you on whether they're dorsal or ventral, but we do want you to know that they're rootlets that lead to a root. Okay, and the root is up in here. It goes through the dura mater, and then in the fat tissue that you're going to see is where you start to get your ganglion. All right, so it has to go through the dura. Okay, so these rootlets, and you'll see these little fan-like structures all along, just like that, all along, and that goes through the dura to make your root and ganglion. Okay, so you'll be able to see that in lab. So the ventral side has that deep fissure that has the blood vessel running through it. On this one, the dura has been taken off all the way, but you can see some denticulate ligaments still adhering it on. At the inferior end of your spinal cord, you have a larger lumbar area, and then in a human, there's a structure called the conus medullaris that comes to abrupt, roundish ending. Now we're seeing with the hog that the spinal cord is continuing, and that is, we're making an educated guess that that's because of their tail. But in the human, there would be an abrupt ending here for the conus medullaris. Now off the end of the spinal cord here, you have what's called the Cauda equina, also known as horse's tail, and you see all these filaments. And these are nerves that are reaching down to the lower end of the body, caudal end of the body. And that's why it gets its name Cauda equina. And in the humans, we have this as well. But the main difference is this conus medullaris in a human probably would end in this area, and you'd see an abrupt ending, where here we're really not seeing an ending at all.